There's a number of supplements and dietary compounds that have beneficial effects of boosting your mood. Individuals with depression have been reported to have low levels of inositol in the brain, in the frontal and the prefrontal cortex. Inositol has been concluded to be likely effective for depression according to a meta-analysis of double-blind, randomized controlled trials. Myo-inositol at 0.6 to 2 grams per day was reported to reduce depressive symptoms in a study on women with premenstrual depression. Some evidence also suggests myo-inositol can act by decreasing serotonin transporter activity, and thus it increases the available serotonin in the brain. St. John's wort, or Hypericum perforatum, is one of the most studied herbs with antidepressant-like effects, and it's even widely prescribed for depression in Europe. The recommended dose is 900 to 1,800 milligrams per day. According to multiple meta-analyses of double-blind, randomized controlled trials, St. John's wort is reported to have antidepressant effects similar to SSRIs, with very few side effects. It's also been reported to potentially prevent or delay depression relapses in 426 patients in a double-blind, randomized controlled trial. It's believed to act in part by increasing serotonin receptors and dopamine signaling. It also can inhibit serotonin reuptake and glutamate release. However, these mechanisms are still only based on relatively early studies, and more research would be needed to figure out the exact biological mechanism that this herb uses in the brain and the body. Low levels of omega-3 have been associated with depression. According to a few early studies, omega-3s have been reported to be effective for those with clinical depression, as well as non-diagnosed individuals with depressive symptoms. According to one meta-analysis, EPA may be the most beneficial specific type of omega-3 extract when it comes to depression-related symptoms. Adding omega-3 to the antidepressant citalopram, an SSRI, was reported to improve depressive symptoms in 42 patients. Some researchers have proposed the omega-3s reduce depression by lowering inflammation in the brain. S-adenosyl L-methionine, or SAMe. According to one meta-analysis, this compound has been reported to be effective and safe for treating the symptoms of depression. In one study, a double-blind, randomized controlled trial of 73 patients who didn't respond to SSRIs, 800 milligrams of SAMe taken twice a day for 6 weeks was reported to lead to improvements in depressive symptoms as well as reduced remission rates. Some researchers have proposed that the SAMe has therapeutic effects similar to that of common antidepressants like SSRIs, and it may also have some advantages over the common depression medication, such as the relatively fast onset and the increased safety and lower rate of adverse side effects. Although its precise mechanism is not yet fully known, some evidence suggests the SAMe effect might stem from the improved methylation of the neurotransmitter catecholamines, increased serotonin and norepinephrine levels, and increased dopamine activity. However, more research would be needed to explore the potential mechanism further. Curcumin, an extract from the spice turmeric, has been reported to reduce depressive symptoms in patients with major depression, while also being safe. For example, curcumin taken at 1 gram per day for 6 weeks reduced depression along with inflammatory cytokines and cortisol stress hormone, and an increased brain-derived neurotropic factor in 108 adults. According to one animal study, administering curcumin along with piperine, a compound that's found in black pepper, it was reported to enhance the antidepressant effect of SSRIs in mice. Similarly, another study in mice reported curcumin increased serotonin and dopamine, and it blocked MAOA and MAOB, and it's also been suggested curcumin can also promote the development of new brain cells in stressed rats. Low DHEA levels have been associated with increased depressive symptoms, and they're often especially low in clinically depressed patients. A handful of double-blind, randomized controlled trials have reported that 90 milligrams per day or more of DHEA can reduce depressive symptoms and improve mood. DHEA is believed to influence the release, the breakdown, the reuptake, and the receptor binding activity of serotonin, dopamine, glutamate, and GABA, and this can account for some of its effects. Recently, scientists have proposed that the gut microbiota may have a surprisingly significant influence over the brain function. For example, it's been reported people who have inflammatory gut disease often also have depression. According to some early human studies, probiotics help to reduce depressive symptoms in both healthy and depressed individuals, although a lot more clinical trials in humans are needed to confirm this. Because serotonin is produced in the gut, changes to the gut microbiome may theoretically influence serotonin levels and activity in the brain. Using this logic, some have proposed that probiotics can enhance the diversity of the microbiome and promote a more favorable environment for serotonin synthesis. Some early evidence suggests probiotics may also reduce systemic inflammation, and this is another factor that's often reported to be elevated in people with depression. The most common probiotic species used for mood-related effects include L. helveticus, B. longum, L. acidophilus, L. ramonis, B. bifidum, L. casei, and L. pentasus. According to a few early double-blind randomized controlled trial studies with 40 patients each, Saffron was reported to reduce depression in patients with mild to moderate depression without major side effects. Saffron supplementation of 30 mg per day for 6 to 8 weeks has also been reported to reduce depression similar to SSRIs in 124 patients with depression. Some early studies suggest the saffron might act by inhibiting the reuptake of dopamine, norepinephrine, and serotonin, as well as blocking the NMDA receptor. You can take saffron as a tea or as a supplement. According to a few early studies, acetyl L-carnitine has been reported to reduce depression symptoms. Between 1.5 to 3 grams per day for 30 to 60 days was reported to reduce the depressive symptoms in elderly patients in a double-blind, randomized controlled trial. Similarly, one double-blind, randomized controlled trial of 204 patients with chronic depressive symptoms reported acetyl L-carnitine at 1 gram a day for 12 weeks improved depressive symptoms similarly to amisulpride, which is an antidepressant medication. According to some researchers, the acetyl L-carnitine might act by increasing cell growth in the hippocampus, raising brain-derived neurotropic factor, stimulating glutamate release, and increasing serotonin levels and receptor activity. Some evidence suggests depressed individuals have lower folate levels than non-depressed ones. 15 mg per day of methylfolate for 6 months improved clinical and social depressive symptoms in a study, a double-blind randomized controlled trial with 123 depression and schizophrenia patients. Folate can also improve response to antidepressant drugs, at least according to one early study. Folate is known for its role in the production of the neurotransmitters serotonin and dopamine, and some early evidence also suggests folic acid can stimulate serotonin receptors in the brain, although more research would be needed to confirm this effect. According to one study, a randomized control trial in 73 depression patients with lower levels of B12, supplementing with this vitamin at 1 mg per day for 6 weeks was reported to improve depressive symptoms. Vitamins B2, B6, B9, and B12 have all been reported to reduce homocysteine levels and to reduce depressive symptoms in a study on 236 patients. Deficiencies of vitamin D have been associated with increased risk of depression and suicide. One meta-analysis reported 600 to 800 international units per day of vitamin D improved depressive symptoms. According to one randomized controlled trial study, 3,500 international units of vitamin D for 1 month was reported to improve the symptoms of seasonal affective disorder. Vitamin D supplementation also reduced the suicide risk linked to vitamin D deficiencies. Some evidence suggests vitamin D can increase the enzyme tyrosine hydroxylase, and this is responsible for producing neurotransmitters dopamine, norepinephrine, and epinephrine. One study also suggests vitamin D can help to protect against dopamine and serotonin depletion in the brain, specifically in the striatum and the nucleus accumbens. A handful of randomized controlled trial studies, in total with 262 people, reported that kava root improved depression, anxiety, insomnia, sleep quality, cognitive performance, mood, and tension. Some very preliminary findings suggest kava may work by improving GABA-A receptor communication, as well as by inhibiting norepinephrine reuptake. 500 milligrams of valerian by itself or with St. John's wort was reported to reduce depression, stress, and anxiety in a handful of early human studies. According to a few animal studies, valerian may have helped to prevent stressed rats from developing depressive-like behaviors, while also increasing serotonin levels and overall cell growth in the hippocampus, a brain region that's believed to be involved in regulating mood, among other important functions. Because of its sedating and calming effects, some researchers have proposed melatonin might help to counter the sleep disturbances often found in depression. Individuals with depression have often been reported to have low circulating levels of nighttime melatonin, as well as compromised melatonin circadian rhythms. Furthermore, many antidepressants increase melatonin, and this suggests a common basis for their respective effects on mood. According to one double-blind randomized controlled study, 3 milligrams of melatonin at bedtime for 6 months lowered depressive symptoms in 79 women. Some early evidence suggests melatonin might improve the circadian rhythm of a number of different important neurotransmitters that are believed to be disturbed in depression. According to one animal study in rats, some of melatonin's effects might be due to its influence on norepinephrine levels, specifically by binding to norepinephrine transporters and blocking the enzyme MAOA. One randomized control trial reported 340 and 680 milligrams per day of RHODIOLA rosea decreased depressive symptoms, insomnia, and emotional instability in 89 people. Some researchers have also suggested RHODIOLA rosea also shows antidepressant-like effects in rats who are exposed to chronic stress, although it's not yet known what effect this herb has on human biology. In animals, RHODIOLA rosea has been reported to lower cortisol, to reduce stress-induced protein damage, decrease nitric oxide levels, and inhibit MAO enzyme. It's also been reported to increase serotonin levels in the hippocampus, and it might even play some role in repairing damaged hippocampal cells. Magnolia bark has historically been used in traditional Chinese medicine. Its active compounds include hunicol and magnolol, each located in the bark of the tree. According to a few animal studies, these compounds were reported to reduce depression and anxiety-related behavior in animals. However, no studies have shown similar effects in humans, so the results of these early animal studies should be taken with a grain of salt. Some researchers have proposed the magnolia bark works by activating GABA-A receptors, as well as potentially by blocking the activity of dopamine and serotonin transporters, thereby increasing the levels of these neurotransmitters. Magnesium deficiency has been associated with the risk of depression and suicide. According to a few studies, magnesium can improve depressive symptoms in people with postpartum depression, premenstrual syndrome, type 2 diabetes, and chronic fatigue syndrome. However, whether these effects would hold up in people without these specific conditions has yet to be confirmed. Some researchers speculate that magnesium might work by blocking the NMDA receptor, and this could reduce the effect of the neurotransmitter glutamate. According to one study in 20 patients with major depression, L-theanine intake, 250 milligrams per day for 8 weeks, was reported to improve depressive symptoms, anxiety, sleep disturbances, and cognitive function. In one animal study in mice who were exposed to chronic stress, L-theanine reportedly reduced the depression-associated behavior. Some research has suggested, due to its structural similarity to glutamate, theanine may act by binding to the glutamate receptor and increasing overall glutamate activity, which is often reported to be disrupted in depression. Zinc deficiency has been associated with increased depression prevalence and severity. Furthermore, non-responders to antidepressant drugs have reportedly lower levels of zinc than patients who respond successfully. One meta-analysis of multiple randomized control trial studies concluded zinc may be an effective standalone or supplementary treatment for depression. Zinc at 30 mg for 12 weeks was shown to increase brain-derived neurotropic factor levels, according to one double-blind randomized control study on 50 people. These increased levels of the brain-derived neurotropic factor were correlated with lower depressive symptom severity, suggesting a potential relationship. Chronic zinc treatment has been reported to increase serotonin receptors in rats, although this finding has yet to be directly confirmed by human studies. One study has reported creatine supplementation of 3 to 5 grams per day for 4 to 8 weeks can lower the depression symptoms in people with methamphetamine dependence or treatment-resistant depression. Creatine taken at 5 grams per day with an SSRI improved the symptoms more than the SSRI alone in a double-blind randomized control trial on 52 women with major depression. On the mechanistic level, supplementing with creatine theoretically reduces the body's need to synthesize creatine, and this can increase the total available amount of S-adenosyl N-methionine, or SAMe, throughout the body and the brain. And furthermore, some evidence suggests that creatine may reduce homocysteine, high levels of which have been associated with depression. Aromatherapy using lavender was reported to alleviate depression, stress, and anxiety in a handful of randomized control trials done in 28 postpartum women with 80 major depression patients. Application of lavender cream nightly for 8 weeks reportedly reduced depression, anxiety, and stress in another study on 141 pregnant women. According to a randomized control trial of 45 depression patients, when combined with a traditional antidepressant medication, lavender was reported to reduce depression more than just the antidepressant alone. Some evidence from studies in mice suggests lavender oil might act by increasing dopamine receptors as well as by binding to NMDA receptors to decrease their activity. However, it's not certain whether this mechanism is relevant to human users, and more research is needed. According to some studies in both humans and animal models, ginseng has anti-inflammatory, antioxidant, anti-stress, and antidepressive effects. Ginseng was used to reduce depression symptoms and to increase quality of life rating in 477 postmenopausal women in a double-blind randomized controlled trial. Some early evidence suggests ginseng might act by increasing hippocampal dopamine, serotonin, and brain-derived neurotropic factor levels, and by lowering the levels of nitric oxide and pro-inflammatory cytokines. According to one double-blind randomized controlled study in 54 healthy seniors, bacopa extract 300 mg a day for 12 weeks was shown to improve depression and anxiety symptoms, as well as to increase working memory and attention. According to a handful of animal studies, it's also been reported to alleviate mixed anxiety depressive disorder, and it protected against acute and chronic stress. It can also help to preserve dopamine levels that are otherwise depleted in chronic stress and drug-induced neurotoxicity. Apigenin has been reported to alleviate mild to moderate symptoms of depression, stress, and anxiety, according to a few double-blind randomized controlled trials, with a combined total of 118 participants. The apigenin reportedly lowered depression in mice, possibly by increasing the brain levels of brain-derived neurotropic factor, as well as reducing inflammatory enzymes like nitric oxide synthase and COX-2. In one study, a double-blind randomized control trial with 196 patients with IBS, an intake of 400 mg per day of berberine for 2 months reduced depression, anxiety, and the IBS symptoms, while also improving the patient's quality of life. However, because the study only looked at patients with specific pre-existing medical condition, more follow-up research would be needed to know if berberine would have similar effects in otherwise healthy humans. An animal study also reported that berberine might be useful for alleviating depression and anxiety symptoms that follow morphine addiction. Berberine has been reported to increase serotonin, dopamine, and norepinephrine in the brain, in the hippocampus and the frontal cortex, as well as inhibiting the enzyme MAOA. Some studies have reported decreased pregnenolone levels are often associated with cases of depression. Pregnenolone at 100 mg per day was reported to lower depressive symptoms in 150 bipolar and depression patients. Depression has been associated with abnormalities in brain microtubule function. By increasing the formation and the stability of tubules, pregnenolone's effect on mood might come from an increase in the growth of brain cells. Pregnenolone is also required by the body to make cortisol stress-fighting hormone, and for its conversion to the sex and stress hormones like DHEA, testosterone, and estrogen. 5-HTP is one of the ingredients, the metabolic precursors, that the brain naturally uses to produce serotonin. Some early evidence suggests the antidepressant-like effects of the 5-HTP might be comparable to that of prescription antidepressants. According to one study, the combination of 5-HTP with a typical antidepressant medication, an SSRI, raised serotonin levels by as much as 500% in 52 healthy men. However, raising serotonin levels too high has risks due to serotonin syndrome. For this reason, some clinicians have recommended only using slow-release forms of 5-HTP when taking SSRI medication. Nonetheless, because of the potential risk of combining 5-HTP with prescription antidepressant drugs, it should only be done under the supervision of a doctor. According to one study, holy basil or tulsi at 1 gram per day for 60 days was reported to reduce feelings of depression, stress, and anxiety in 35 healthy participants. According to one animal study, holy basil also reportedly showed antidepressant effects similar to commonly prescribed antidepressants, and it led to improved anxiety, memory, and cognitive function. One human study reported in 7 depressed adolescents with bipolar disorder, uridine treatment for 6 weeks was associated with decreased depressive symptoms. However, this is a small sample size, so more research would be needed. In rats, uridine alleviated depression-like behaviors and it increased dopamine in the brain. In other studies, when uridine is combined with DHEA from an omega-3 fish oil and a choline source, it was shown to increase the growth of new brain cells. Tyrosine is one of the ingredients, the metabolic precursors that your brain uses to make the neurotransmitter dopamine, as well as epinephrine, norepinephrine, and several thyroid hormones. According to several case studies on individual subjects, tyrosine has been reported to improve depression. However, a trial of 65 patients did not support tyrosine as an antidepressant. One possibility is that tyrosine might only help people with naturally low levels of dopamine and norepinephrine, although more research would be needed to figure out this exact mechanism. Borage is a herb native to Iran, sometimes referred to as oxtongue. According to one study, 375 mg of borage per day was reported to reduce depressive symptoms after 4 weeks in a double-blind randomized control trial with 35 individuals. However, it was not effective after 6 weeks, suggesting that its effects might only be temporary. According to a few human studies, olive oil consumption has been associated with reduced overall risk of depression, as well as improving depression symptoms. Consumption of olive oil and oleic acid, the primary fatty acid in olive oil, was reportedly associated with reduced depression risk in a trial in 4,271 participants. Some early evidence suggests olive oil might act by increasing the release and the turnover of dopamine. Other preliminary evidence suggests the oleic acid in olive oil produces olamide, and this might act by increasing neurotransmitter binding to serotonin receptor. Some evidence suggests that individuals with depression are often riboflavin deficient. According to one study, riboflavin, or B2 intake, was reported to prevent postpartum depression in 865 women. A supplement containing 10 milligrams of B1, B2, and B6 was reported to alleviate depression symptoms in a double-blind randomized control trial on elderly depression patients. However, riboflavin's effects may depend on gender. For example, according to a study on 6,500 adolescents, the increased riboflavin intake was associated with decreased depressive symptoms in girls, but not in boys. Low B6 levels have been associated with increased depressive symptoms. In one study on 140 healthy participants, women consumed more food containing B6 were reported to have a lower risk for depression. For more information on neurotransmitters, depression, herbs, supplements, or natural treatment plans, check out my website.